This is episode 9 of the Fitness Plus Technology Podcast with our guest, Graham Melstrand.
Just imagine what would be possible if your data could be uploaded from your apps and devices to your electronic medical record, if the insurers and your physicians were tracking the vital signs around physical activity. What would be possible if you could share that information voluntarily with your insurance provider? Clearly, when we're looking at the emergence of technology in support of our space that's coming from outside through these wearable device companies, they should be an asset, not perceived as being a competitor in our space.
Welcome to the Fitness Plus Technology Podcast for club owners, operators, and fitness professionals. I am your host, Josh Trent, and this is your number one trusted resource for the accelerating world of fitness technology. Each week, we bring you an expert interview with global influencers at the crossroads of fitness and technology. You'll gain the insights, tools, and inspiration you need to stay connected to the pulse of what matters most for your fitness business in the age of exponential technologies. This podcast is brought to you by the Fitness Industry Technology Council, who is mobilizing resources to drive the fitness industry forward and representing leading companies and organizations to success through collaboration. This show is supported by Videri Ventures, a boutique investment and advisory firm helping early mature and late-stage enterprises succeed in a new era. On today's show, we're talking with the Executive Vice President in Corporate Affairs at the American Council of Exercise, Graham Melstrand. Graham develops opportunities and relationships that advance ACE health policy positions and fitness industry standards. He is the one who assesses these legislative positions at different levels of government that align with the ACE mission, while monitoring the existing legislation and regulatory policy while informing ACE of the potential impact it has for exercise professionals, the public, and other stakeholders. Graham creates relationships with key policymakers and collaborative organizations while serving the advisory capacity on a number of boards and committees, including being president of the board for the Coalition for the Registration of Exercise Professionals within the Commission on Accreditation of Allied Health Education Programs and other regulatory agencies. Graham holds a bachelor's degree in physical education and athletic training from California State University and is a former competitive cyclist. He participated in the U.S. Olympic trials in 1984 and 88 and was a member of the U.S. National Team Development Program from 83 to 1990. As we look ahead to the unlimited potential for 2017 and beyond, technology for managing the health outcomes of large groups is definitely top of mind for many in the health and wellness industries. So on today's show, Graham is going to uncover why programmatic-based training delivery models are showing success in the fast-paced change of the group fitness world. You'll learn why a few key national programs are moving health progress forward by blending the activity data and prevention programs with and without government reimbursement. You'll see the roadblocks and the opportunities that exist not only for smart health club owners, operators, and trainers in the group health technology world, but also how geo-targeting is being used for ROI in building infrastructure for walkable communities to get people moving and living their life well. This is an episode you're going to want to hear twice because Graham has packed an incredible amount of knowledge into these next 30 minutes. Let's get into this compelling conversation with Graham Melstrand. Graham, welcome to the show.
Happy to be here. Thanks so much for having me.
We're focused today on technology behind trainers growing into the health coaching space. We're going to talk about group fitness technology and programmatic-based delivery models. Now, Graham, your background, it's almost 30 years in fitness. You were a sports cyclist. You're now the Executive Vice President, Corporate Affairs for the American Council on Exercise. But shed a little light. What was your path to actually become VP of Corporate Affairs now? I know you're an athlete in the past, and give us a little context on you.
Sure. Well, I started out as a competitive cyclist. During part of my career, I spent a little bit of time at the elite U.S. Olympic Training Center in Colorado Springs. And on one of my visits there, I had been involved in a crash and was treated in their sports medicine department and got my first exposure to the athletic training profession. And my first thought is, wow, this is a job. This is fantastic, working with athletes in this great facility. And made a decision that was the career choice that I wanted to pursue. Selected a college, Cal State Long Beach had a prominent program for athletic training, and went through that and then realized that to a large extent, most of the people that are working in athletic training are working in high schools or junior colleges and splitting their time in physical therapy clinics. And the clinical setting really wasn't for me, and I had some opportunities to explore on the equipment side of the fitness industry, and moved into that and was able to use my background in the space to develop a career on that, and then was recruited back to the American Council on Exercise a little more than 16 years ago on the education side. So I've really been on all sides of the industry, starting first as a practitioner around my own personal passion for the space, and then on the business side, and then coming back to the education and advocacy space, really with a strong desire to share that passion for physical activity and health with everybody.
You're also the president, the board of directors for the Coalition of the Registration of Exercise Professionals. For people that might not know what that is, just unpack that a little bit.
As we move forward in our space, exercise professionals are increasingly well positioned to really provide a significant contribution on the preventative health side of things. But of course, in a lot of ways, the fitness industry still suffers from some persistent and pervasive stereotypes around practitioners that undermine the confidence that consumers and referring professionals and payers have in the individuals that are working in our space. What's happening on an international level is there are a number of national registries that have been established and serve the purpose of identifying individuals that hold current credible credentials in the space, and then offering a vehicle, a registry of exercise professionals that can then be used by employers and consumers, or in countries that have nationalized medicine where there are some active roles for the exercise professional, where they can verify the credentials of those individuals. So there's an issue of transparency around that people expect in established professions, and we're trying to do that same thing here. One of the things that's unique about the fitness space is there are a significant number of credible organizations that are offering credentials, some of them the same in the case of, say, personal trainer, some of them unique, but to be able to verify those credentials based on a uniform standard of third-party accreditation, we look at as a pretty important piece. And as preventative health and more professionalization of the space become increasingly important through health reform and other means, we want to make sure that we can provide that pool of individuals across all of those exercise professional job roles that people can be confident in.
And your background stems also to community health. So you have a lot of depth in community health. And recently, I guess you could say maybe in the past 3 to 5 years, have you seen ACE and yourself more focused on the influence of technology for the fitness professional?
Oh, absolutely. And when you're talking about the community health part, one of the things that's really interesting when you look at the public health community is that they know that the fitness industry and the exercise professionals are available in their community, and they recognize the knowledge, skills, and abilities that they have and the potential of the space. But within that public health community, there's also a perception that perhaps that we're really more country clubs for people that like to pick up heavy things than a legitimate resource that is available to provide leadership and expertise around physical activity. Mm-hmm. And what's happening that's kind of bringing all the pieces together is that we've got this new influence in technology, particularly in wearable devices, that's really exposing that public health community to the potential of technology, especially when it's supported by the expertise of individuals in our space, the exercise professionals that can help individuals interpret that data. But it also allows them, perhaps for the first time, to tap into the potential of that aggregate data from the apps and devices that could be shared to improve population health. And so just imagine what would be possible if your data could be uploaded from your apps and devices to your electronic medical record, if the insurers and your physicians were tracking the vital signs around physical activity. Are you active most days of the week? Do you accumulate the 150 minutes a week of moderate exercise, which is kind of the key to good health status as opposed to performance or the vanity benefits? And what would be possible if you could share that information voluntarily with your insurance provider to document your physical activity, and what that might mean perhaps in terms of attenuation of your healthcare cost or your premium cost. Further, when you're looking at infrastructure, there's the concepts of complete streets and walkable communities. And we know with 1 in 10 adults over 18 now using some type of activity tracker, that we would be able to perhaps geo-target for optimal return on investment in infrastructure, whether that's connecting if you identify a community that's very active, that has great infrastructure, maybe you don't make an investment there. If you can identify some where they don't have that level of physical activity or connectivity to places to be physically active, looking at the walkability scores, utilization, we could go granular all the way to those neighborhoods and make appropriate investments as necessary to change that status.
I think some of the power around collecting all this data is, what does the health professional, or maybe in your case, what does the city organization do with all this data? Now, later on in the talk, we're going to go over some of these different health coaching spaces. We'll also mention your ACE presentation that you did with Ted Vicky, leveraging tech to help create active walking communities. But there was something in the presentation that came up, Graham, that was shocking to me, and it was the percentage of adults meeting physical activity guidelines. Now, this is from the CDC. It was 150 minutes of moderate physical activity or 75 minutes of vigorous activity per week. What were some of the findings that came up through that data of the CDC?
When you look at that, there's only 4 states in the country that have the type of acceptable levels of physical activity. There are 11 states where greater than 23% of the population aren't meeting physical activity guidelines. They don't have any free time physical activity built into their schedules. But we have 2 issues. One is around health literacy. Do people know that they need that 150 minutes a week? And then are they getting it? Physical inactivity is directly tied, and there's a positive correlation between no activity and prevalence of overweight and obesity. There's a correlation between how much activity that you're getting and the rates of chronic disease. And you're looking at a population that just is not as active, and quite frankly, in a lot of ways, we've engineered it out of our daily lives, particularly in affluent countries like ours. People aren't active in terms of transportation to and from work or to and from school at this point, and quite frankly, they really don't know how much they're getting. That's where some of these devices can really be so valuable, because what they do reveal is that we're not moving enough, and if we're tracking the nutrition side of things as well, that we're probably eating too much of the wrong things at the same time.
And I think some of the power around this data is it's 2 sides, right? On one side, we have something that the user gets to experience. So they know their steps, they know their sleep, maybe they're putting in nutrition. But on the trainer or the coaching side, right now, what we're seeing and what you and I have talked about before is that an hour of a trainer's time and they work with one client. This programmatic based delivery model versus a session based model. Let's dive into this. I mean, people need help, and they need help more than just one at a time. What do you see as something that could be of value to programmatic-based delivery models instead of just this current session-based model?
Well, and I believe the session-based model that we have in personal training will continue to exist. There's a market for that, and I think we do a fairly good job of tapping into that in most of our facilities today. But if you go back to kind of the root of this is we get older and we go to our physician each year for a physical. If you're following the trend, most individuals will gain 2-3 pounds a year, which 1 or 2 years doesn't really show up that much. But if you continue that trend for 10 years, now you're approaching, or you're in middle age, and your physician tells you that how long is this trend going to continue in terms of your weight? You need to move more, you need to eat better. And for a lot of people that aren't actively involved in fitness and physical activity now, they could have told the doctor that. They got up, they put on their pants, and had to go into the office. The big question then becomes, now what? Where do I go for the leadership and the expertise? And even when people are starting out with their own devices and they're self-monitoring, they need to have access to the leadership and expertise to interpret that data. Some of our survey data for the industry and wearable devices suggests that 72% of clients are asking for insight and feedback on wearable devices. What does this mean and what do I do with it? And the problem with the session-based model that we have now is it's a bespoke solution. You're talking about individuals that are kind of the most affluent of the most affluent when you look at your membership pool that really have access to it, or they've made it a very significant priority. But to your point, for the exercise professional delivering those services and for the facilities that employ them, that's a challenging model because it's very time intensive, it's expensive to deliver, the margins are very low, particularly for employers by the time all the payroll taxes and sales loads and discounts for volume are applied, but it also only allows you access to approximately 3 to 5% of your membership unless you're running a studio. And when you compare that to what the potential is if you're running program-based models where it's around the outcome-based goals that a group of individuals would have. And those, traditionally, when we see those in the fitness industry, they tend to be around golf fitness or swimsuit season or ski conditioning. But there's a whole other category of opportunities associated with this around weight management. You have diabetes prevention program opportunities. The range of interests that consumers have is very significant, and I don't think that you need to look any further in terms of potential models than what you see around kids' activities. All of the different types of programs that parents enroll their children in. The delivery model is always scalable. It's a one-to-many. It's scripted to a certain extent, and there's a specific set of outcomes that you're pursuing. The other advantage that you have with this is it offers employers and professionals a couple of different options in terms of how to attract participants. It doesn't need to be based on a membership as a prerequisite to access to the service. You can have non-member programs. The opportunities, particularly around workplace wellness for smaller employers, and really you can look at smaller employers as under 500 employees, but really when you get in that 20 or 30, they don't have the expertise, they don't have the infrastructure in terms of facilities or the staffing to deliver programs internally. And if you're a small employer that's trying to take advantage of some of the workplace wellness provisions within health reform, you have to have a partner in the community, a facility or an exercise professional that you can tap into. And then those become the type of self-pay services that really work so well. We also see the emergence of some health coaching models that are tied to workplace wellness and physician referral. We see some physician referral programs for people that are at risk for or affected by chronic disease that work extraordinarily well.
What kind of brands right now do you see that are really doing it right when we look at this session-based model to a programmatic model? I mean, is anyone out there really leading the charge using technology to scale and help as many people as possible?
Sure. There's a couple of examples that I'm really fond of, and I'll give a kind of a broad cross-section of those right now. The Atlantic Coast Athletic Clubs, ACAC clubs, Dr. Gregory Degnan is an orthopedic surgeon that's their medical director, and he's developed two programs that they use in all of their locations and that he licenses beyond that. There's the PrEP program, physician-referred exercise program, and then they also have a prehab program that they use for individuals that are going in for joint replacement surgery to prepare them by strengthening them in advance of their surgical procedure, looking for a faster recovery. These programs, the physician-referred ones, they have that as a cohort of individuals that come in that are separate from the general population of the club. It's sold as a non-member program. It's 60 days for $60, and it's really focused on the physical activity guidelines plus some strength training and other lifestyle elements. And individuals are in their cohort with their other PrEP members, and not only do they have an extraordinary transfer to kind of a more traditional membership where they can continue that health-based programs, the retention of those individuals is quite remarkable compared to those that join as traditional fitness members there as well. Another group that's running a program called Genovix out of New England. They're working with a number of insurers and with workplace programs that is a health coaching and lifestyle change model that they're having quite a bit of success with. The YMCAs are a core portion of the delivery for the CDC's diabetes prevention program, which just last week was approved for reimbursement under Medicare, Medicaid. I would note under the objection of Big Pharma was concerned about this.
That's a very big development. I mean, when we look at how much finance could be saved by people being healthy, especially with these groups leveraging technology. I mean, what's the roadblocks? What do you see why there's not more ACACs, why there's not more Genovix? Why are these slow to grow right now?
Well, I think there's a couple of reasons for that. One, the fitness industry has really kind of grown organically around supporting the individuals that are interested in sports and fitness for the sake of fitness. And perhaps we haven't quite created the right set of programming offerings and the inviting environment to bring in the next 30% of the population, if you will. The other thing that happens is these programs, when you set them up, it's quite labor intensive to train your staff and to recalibrate how you approach a wellness clientele as opposed to a fitness clientele. And those things, particularly when you look at some of the challenges that the industry is facing now around some of the minimum wage laws, the exempt, non-exempt, they're not quite sure how to stand these programs up in parallel to what they're already offering. They're going as fast as they can, if you will, on the hamster wheel to make money in the system that we've always existed in. And there quite frankly has to be a little bit more development, I think, of the leadership of fitness departments to make the managers perhaps more effective and more capable of running these type of outcome-based programs. And from a technology standpoint, we also lack the infrastructure in the fitness industry, if you will, around any type of substantial surveillance tool around how much physical activity members and participants are getting compared to what you'd have like in athletic training. They have an injury surveillance system that the high schools and colleges all feed, and then that data is available really to all around what they're collecting. But imagine how difficult it would be if you didn't know what was happening on other campuses with respect to your athletes, and you weren't aware of an emerging trend that you could positively impact either through coaching, through further development of your athletic training and medical staff. We need something like that. Clearly, when we're looking at the emergence of technology in support of our space that's coming from outside through these wearable device companies, they should be an asset, not perceived as being a competitor in our space.
Let's shift gears, because I know group fitness is a way that obviously services can be scaled. We're talking about one coach, one trainer working with, tens, maybe even hundreds of people. Graham, I mean, your finger is on the pulse for how this technology is influencing the current space of group fitness. But what do you see now for group fitness instructors and group training programs? And what do you see down the road in the future that might move the needle as well?
Well, I think we're in a terrific time when you look at group exercise programming. The diversity of offerings continue to grow. It's not limited just to facilities and things that happen in the classroom. We've got all kinds of programs that are being delivered in community settings like parks and beaches and at workplaces. We also have within facilities the group exercise on demand that's emerging on that. I think the biggest opportunity here, though, isn't all that different than from the personal fitness side, and that's most of the group exercise programming that we see is really based on a modality of group exercise or the type of programming that people want to participate in, rather than what type of outcome that they're trying to achieve. Mm-hmm. And so it's attracting people that like the format, if you will. Clearly, there are very significant opportunities to ensure that what's being delivered conforms to what they would refer to as a reasonable design criteria, so that it would help you achieve those health outcomes that everybody's looking for, reducing the risk of chronic disease, helping manage overweight and obesity. There's a particular opportunity that we're very attuned to right now around what's called intensive behavioral therapy, which is grade B recommendation from the U.S. Preventive Services Task Force, and it's covered currently by Medicare, Medicaid. And really, it's a behavioral, physical activity, nutrition intervention that targets individuals that are at risk for cardiovascular disease and have an additional risk factor. They estimate that there's 90 million Americans that would be eligible to receive that lifestyle counseling benefit, if you will, but only about 8 million of those individuals have had access to it. And because the reason for that is today that has to be delivered in a primary care setting under the supervision of a physician. If we can transition that or work to help place the exercise professional alongside behavioral professionals and nutrition professionals to have that delivered upon referral from a physician and in communities, we could dramatically impact the availability of that. And if we make that a scalable program, similar to the diabetes prevention program, it could also be made much more affordable.
Right now in the 24-hour fitnesses, I have a few here in San Diego area, and their group training is essentially kind of just some interval training with about 10 or 15 members on a floor a couple times a day. What do you think is holding back gyms from changing and scaling using tech? What do these fitness departments need in order to use technology to help way more people in that gym setting?
Well, I think the first would be kind of a recalibration of expectations. Technology devices aren't competition for the exercise professional. They're a tool that can be leveraged to help you manage a larger client base, to stay in contact with your clients, to manage a group of individuals. When you look in the endurance sports category, a company like Carmichael Training Systems, the coaches that are working in that manage a very significant population of endurance athletes, whether they're runners or cyclists or triathletes, and the clients that are paying for those coaching services are doing it based on kind of a level of personalization, if you will. I think there's a lot that we can learn from today's sports performance world about how those type of endurance coaches, the strength and conditioning coaches that are in Division I institutions where they have 600, 700 or more athletes that they're managing, can use technology to communicate with the consumers that they're supporting, report on their efforts and their outcomes. I think we're missing a real opportunity. You just wish that the leadership could come from within our space. If we don't do the data and we can't demonstrate the outcomes, I don't know how we get the leverage to more fully participate. It's going to come, whether it comes from the people that are currently within the space or from someplace else. And I think Greg Degnan would be a great guest as well at some point, is he believes that the fitness industry, actually, there's a separation that's forming between those that are kind of in the traditional fitness and what I would call physical entertainment space or hospitality space, and those that are focused on the health side. And he believes that that's okay, that's normal. People, not everybody wants to be in the health side, but there's tremendous upside for those early adopters and the ones that want to tap into that next group. The service delivery model is just going to look a little bit different. But at least for a period of time, I would imagine there'll be room for everybody.
Yeah, so this pushback possibly from the management is because you had mentioned before, Graham, they're on the hamster wheel. They're kind of making the money doing what they're doing now. As we look towards 2017, I'm curious what you see as kind of a top tier for the actual systems that might be in place. Let's say you could create a dream gym system where you're working with 50 people. A coach could work with 50 people, or a coach could actually work with more people than that. What do you think that might look like? I mean, would it be something like the ACAC, or is that comparing apples to oranges?
Well, I think that's a little bit comparing apples to oranges. Certainly, that's a little bit different delivery model. What you're talking about is a fee-for-service model that doesn't require a membership to join, that's physician referred, and then it's very specifically focused around the lifestyle and the health outcomes. I think that the ability to have a virtual membership, if you will, that's device and application based, where you've got access to the expertise within facilities, but doesn't require that individuals utilize the bricks and mortar, could create a whole separate category of opportunity for employers in the health and fitness space and allow them to drill down further into the communities and really create that sense of community that I don't think exists the way we'd like it to in fitness.
Yeah.
I think there's a lot of parallels between what you see in terms of how the bricks and mortar retail model has evolved to include online. You've got consumers that they still want to go and they still want the experience of shopping in a bricks and mortar, and they want to see and touch and feel. And then you have the ones that want to see it and be able to purchase it online, or purchase it online and return it to bricks and mortar. But then you also have that emerging population of people who say, look, I want access to the expertise when I need it, but I don't need to come into the space. I want to be out in my community, or I want to do this at home. I don't know why we as an industry wouldn't want to tap into that that population.
Graham, when we look at the life and health insurance community and the potential for discounts that are given through the data that's received through the trackers, I mean, what does this look like right now in this space? What kind of discounts could these insurance and health companies give, and what would that look like?
We're actually seeing some interesting activity around this right now. There are a number of insurance companies that are providing incentives in the form of discounts on premiums or rewards associated with uploading the data from your wearable device or the apps that you're using. There are a couple of insurers that are doing this right now. And on the life insurance side, there's a really interesting program from John Hancock Insurance that's called the John Hancock Vitality Program that's asking people to share the data from their devices, and they're awarding points, if you will, around simple everyday activities, going to the gym, getting your health screening, staying tobacco-free, and you earn status, bronze, silver, gold, or platinum, based on the number of points that you accumulate, and they're in turn providing a reduction on premiums. The more points that you're accumulating through your physical activity or your lifestyle choices, the greater the discount that you're receiving. Right now, it appears as if most of these type of offerings are really coming out of marketing or other dollars rather than actual risk reduction that they're able to measure and report through their actuaries. But what they're doing is they're trading a benefit for data that they're going to be able to use moving forward. We're already seeing this, say, with auto insurance, with, say, Progressive, where you have the device that you can plug into your car. I know General Motors and Infinity collect data around all of your driving habits that then you can connect with your insurer, and many of them will provide additional discounts if you share that device data with your insurance company. Obviously, if you're engaged in bad driving habits or bad lifestyle habits, those aren't the type of things that you'd want to share. But what it's doing is it's providing that carrot, that positive incentive that I believe over time will be reflected in the healthcare costs that we experience, particularly the out-of-pocket costs. People that are healthy or trying to live their best life will clearly be receiving some greater incentives or some economic benefits associated with this. And we see the same thing within the workplace wellness program offerings that are available now. So this is just the start, I believe, of what we're going to see, where our ability to collect and manage data around physical activity and lifestyle will be recognized and rewarded if it improves health status.
How proactive is that? Where if you can prove that you're leading a healthy lifestyle, that you pay less than someone that smokes cigarettes and that eats terrible foods all day long. So I think it's really, really unique that we're seeing data finally. I think people have been asking this for a while, right, Graham? I mean, there has been a big push specifically around the health and wellness community of, hey, we're collecting all this data, but how does it affect the bottom line? How would you say that it could affect the bottom line for the consumer and for the health or the life insurance organization?
Well, we know today that people that have good health status, their costs around insurance, around medical care, are approximately $1,500 less per person than those that have poor health status. And the more risk factors, the more chronic diseases that an individual has, the higher the associated healthcare costs. And I think there's two parts of this. Obviously, we don't want to punish individuals that have chronic disease, particularly if it's related to genetics, but we all can live our best life, and we can slow the progression of those diseases. We can delay the onset of those diseases. And again, going back to the automotive example, depending on the type of vehicle that you choose to drive, the behaviors that you exhibit when you drive it, in that type of insurance environment or life insurance, if you like to skydive or engage in other high-risk sports, there's a commensurate expense that goes along with that versus those that engage in low-risk behaviors or make less risky choices, if you will. I think it'd be terrific to bring a measure of accountability and information back to the consumer so that they can better understand the things that they can do proactively that'll improve their quality of life, their health, reduce their healthcare costs, allow them to be more productive in their lives and their workplaces. all of those things in my mind would be tremendously positive.
And I think when we're looking at numbers, it'll also make things less expensive for both the companies and for the people. That is such a powerful piece of data being used.
That's what we hope.
Thank you so much for this expertise. There's been a lot of thought-provoking topics from today's show. What are you most excited about for 2017, and where can people learn more about the projects that you're working on?
For 2017, the things that I'm most excited about are really in a couple of specific areas. We do believe that that health coaching is emerging in the fitness space, and these non-member programs are becoming a lot more common. We're moving from those early adopters into that next group of facilities that want to build on the success that their peers have had with them. We see some very interesting opportunities at ACE in the allied health space. One of the things that's happened as a result of health reform is that individuals that are working in primary care settings are increasingly being tasked with providing some expertise, if you will, around lifestyle, physical activity, and nutrition that perhaps they weren't optimally prepared for during their education. So they're upskilling and they're tapping into organizations like ACE for continuing education, professional development in their roles, which allows us to do two things. Expose them to the broader exercise professional community and the fitness industry, improve their competence and confidence around physical activity, and hopefully drive referral to exercise professionals for individuals that need that leadership and expertise. We're seeing prevention continue to be a driver because healthcare costs are not going down or staying the same, which really we believe lends itself to a tremendous opportunity for individuals working in our space to be one of the go-to resources in the community to provide that leadership and expertise around physical activity. We see the job roles within the exercise professional space professionalizing, they're standardizing across the countries. Individuals have portability opportunities if they want to go and work in different countries or come to the U.S., which is exciting. It's just a great time to be in our space.
Thank you so much for sharing your expertise. We're going to link everything, including the webinar on leveraging tech to create active communities. Graham, thanks so much for coming on the show.
My pleasure. Love to come back another time.
The data is showing from ACE and other industry reports that health coaching is emerging in our space, while the non-member programs are becoming a lot more common, where people are moving from early adopters into the next groups of facilities that want to build on the successes that their peers have had. In 2017, technology devices are not the competition for the exercise professional. Rather, they're a tool that can be leveraged to help manage a larger client base, stay in contact with clientele, and manage groups of individuals towards better health. The perception of the public health community about the role of fitness professionals is now changing. From both accreditation and the use of new technologies, this taps into the potential of aggregate data that can be used to increase population health. Thank you for spending some time with me on the Fitness Plus Technology Podcast. I want to thank our sponsors, Videri Ventures and the Fitness Industry Technology Council. You can learn more about becoming a valued partner with FitC, as well as access all the links and resources from today's show by heading over to fittechcouncil.org/podcast. If you're listening on your phone, tap the show artwork and the live link will appear in purple. Support this podcast by leaving us a 5-star review on iTunes. If you've gotten value and been able to take inspired action from the guests and information on this show, head on over to fittechcouncil.org/review, and you can leave your voice to be heard live on the iTunes airwaves. Or just simply tap that show artwork and the review link will be in purple for you to leave right from your phone. Next week, we have another phenomenal show with an expert guest to inspire you at the crossroads of fitness and technology. So until I see you again next week, be well, have an amazing day, and go out there to connect online and offline with the people you care about most.